My name is Dr. Gaurav Sharma. I'm a fellowship-trained upper limb consultant practicing at Sir H. Reliance Foundation Hospital, Girgaon, Mumbai. Today I'm going to talk about one of the most commonly seen problems in day-to-day practice, which is frozen shoulder. Now, there are many myths related to this particular condition. Before we start, let me tell you something about the shoulder joint. Now, the shoulder joint is formed by a cup and a ball part, and there are four major group of muscles which are called as rotator cuff muscles, which keep the shoulder joint at a stable place and achieve maximum range of movement. Apart from this, there is a covering around the shoulder joint like any other joint, which is called as capsule. This is one of the major culprit in frozen shoulder. Now what happens is, frozen shoulder, also known as adhesive capsulitis, there is thickening of this particular capsule which is around the shoulder joint, which leads to decreased range of motion and pain. Now, who are affected by frozen shoulder? Well, typically it affects the people between 40 and 60 years of age and females more than males. Causes of frozen shoulder. Unfortunately, we do not have an answer to this even in 2024. However, people with diabetes, people with thyroid disorders have around 20-25% more risk of developing frozen shoulder. Also, people with history of stroke, kidney disorders, or even previous shoulder injuries are more prone to develop frozen shoulder. Stages of frozen shoulder. Frozen shoulder is typically divided into three phases. Now, the first stage or the initial stage is a freezing stage, which is the most painful stage, in which there is maximum pain around the shoulder girdle. Then comes the frozen stage, in which the pain is at max and also there is decrease in range of motion. The third stage is also called as the thawing stage, in which there is decrease in pain and increase in range of motion. So typically all the three phases usually lasts for around 3 to 8 months each, and the whole course of the frozen shoulder is usually somewhere about 1.5 to 2 years. Symptoms. Not every shoulder pain is a frozen shoulder, which one must remember. As stated earlier, the two most commonly seen complaints are pain and stiffness. Moreover, the patients might present sometimes with night pains. Clinical examination. Firstly, the two most important movements which are affected are forward elevation, so the arm going up like this, and the arm going like this. These are the two most commonly affected movements in frozen shoulder, in which this movement is more important as compared to this particular movement. Now, there are two range of motion which is seen in any type of joint. One is active, in which the movement is done by self, and then there is a passive movement which is done by assistance. In frozen shoulder, the active as well as passive movement is affected. This is something which is very important and to be understood. Now, coming to diagnosis part, the diagnosis of frozen shoulder is usually clinical. However, moreover, X-rays have a limited role, but can diagnose some early wear and tear, which is although rare. MRI can be helpful in patients in which there is suspicion of a muscle tear along with the frozen shoulder. Treatment. Now, there are n number of methods to treat this particular pathology. Now, dealing with the underlying cause is very important. Like, if the blood sugars are high, blood sugar levels should be controlled. If the thyroid levels are deranged, they should be controlled, etc. Now, 95% of the people usually respond to conservative line of management, which primarily comprises of anti-inflammatory medications, physical modalities consisting of physiotherapy, which also involves the shoulder and the shoulder girdle or the shoulder blade bone strengthening exercises, ice packs application. 3 to 5% of the people who do not respond to all of these modalities for around 3 to 4 months, there can be an option of steroid injection which can be considered in such patients. But mind it, steroid injection is a temporary thing which is more indicated in people who are presenting with a pain. So in the freezing stage, the steroid injection definitely has a role, which should be given ideally ultrasound guided and inside the shoulder joint around that particular capsule which is quite inflamed during the frozen shoulder. So, and 1 or 2% of the population who do not respond to any sort of treatment, of conservative treatment like physical therapy, icing, anti-inflammatory medication, steroid injection would require a surgery which involves releasing the capsule. Now, there are other methods like manipulation under general anesthesia, in which the shoulder surgeon tends to mobilize the shoulder joint to achieve maximum range of motion. There are other modalities like hydrotherapy, in which the shoulder joint is distended by using a normal saline, and the adhesions or the stickiness is broken. And lastly comes the arthroscopic capsular release, which I mentioned earlier, in which we see everything inside the shoulder joint and we release the capsule, which is kind of thickened, by which we can achieve a good result. So majority of the frozen shoulder patients would tend to get better over a period of time. with physiotherapy and other modalities, which are conservative. I would like to thank everyone for their kind attention today. For any such queries, do reach out to us at Sir H. Lance Foundation Hospital and Research Center, Mumbai. Have a great day.